Hi, my name is Alessandro Devigus, and I'm a Swiss dentist with a passion for new technologies. Welcome to the space where we explore the latest trends and how to react to them in the smartest way. Because, after all, that's exactly what everybody is trying to do. Each episode will dive deep into dental practice challenges, opportunities, and innovations, offering actionable insights to help you thrive professionally and personally. Thanks for tuning in, and let's get started. Have you ever asked yourself why, despite all the groundbreaking advancements in dentistry, prevention is still such a difficult topic we're discussing just as passionately today as dentists did over 60 years ago? I remember when I started at dental school, prevention was already an important topic, hailed as the future of dental practice. And yet, decades later, we find ourselves still wrestling with this exact concept. Is it truly effective? It is financially viable? Is it worth our time? Today, we're going to unpack exactly why prevention still matters, exploring the common arguments and shedding some light on practical solutions for making prevention profitable, effective, and sustainable in your daily practice. Let's take a step back. Prevention isn't a new idea. In fact, the core principles of prevention or preventive dentistry were already established decades ago. We all heard in dental school, prevention is better than cure. Yet, if we look around, we find many colleagues and patients who still doubt prevention's importance or simply struggle to prioritize it. Let me explain why I believe this topic persists. In many practices, prevention gets pushed aside because it's seen as too time consuming, economically less attractive compared to more immediate restorative or cosmetic procedures. Let's explore some of these arguments together. What we hear most of the time is prevention doesn't pay off. This is partially true. Prevention rarely delivers instant financial results. But think about this. Patients who practice consistent prevention build trust and loyalty to your dental office, meaning long-term patient retention, steady income, and reduced complexity in treatment plans over time. Another thing we often hear is patients simply aren't interested in prevention. Perhaps some patients aren't initially enthusiastic because prevention doesn't feel urgent. They don't have pain, everything's okay. But here's where education and clear communication come into play. If you effectively explain to your patient how investing time in prevention today saves them extensive, costly, and uncomfortable treatments tomorrow, their interest grows considerably. Another argument, prevention elevates your practice reputation. By being proactive and consistent in preventive care, your practice differentiates itself. In our market situation, a point you should consider. Enhancing your professional image attracts new patients who value comprehensive, quality-oriented care, and they're also ready to spend more money. Another point is prevention saves valuable resources long-term. Reducing emergency procedures, limiting extensive treatments, and preventing future dental complications means fewer resources spent on restorative procedures. Creating a sustainable business model. Again, be different than your competitors. Personally, I think prevention is not just a noble idea. It's smart dentistry. But success lies in how effectively you integrate prevention into your daily workflow and patient communication. At the end, it all comes down to how you communicate, how you talk to your patients, and how you make them feel better in the preventive environment. Now, one of very common argument I regularly hear against prevention is this: I simply don't have enough time. My schedule is full, and focusing extensively on prevention feels economically risky. There's an answer to this. I have a practical tip for you. Just try to integrate prevention systematically into every patient encounter. Start by designing short, structured preventive protocols that your entire team knows by heart. Especially dental assistants and your dental hygienists should be involved in all this. In each patient, whether they are scheduled for routine cleaning or something more complex, should receive a preventive education component. No exceptions, because this pays off on a long term. How does this work practically in your office, or let's say how we are doing it in our office? During every appointment, you should dedicate just 5 minutes or even less exclusively to patient education about their oral health, hygiene techniques, and potential risks if prevention isn't taken seriously. Use visual ads, short videos, or brochures to make it tangible and memorable. So patients, they want to see, and then they learn and they get it better in their memories. Train your dental hygienists and assistants to consistently communicate preventive measures. Teamwork ensures the dentist doesn't bear the full weight of prevention education alone. The teamwork is the key to a successful integration of all this in your dental office. Explain to patients in simple, relatable terms how prevention ultimately saves them money by preventing costly future treatments. Patients will be much more receptive when they clearly see the financial benefit for themselves. By taking these small, structured steps, prevention transforms from a vague, idealistic goal into a measurable, profitable reality in your dental office. Throughout our next episodes, I'll share more detailed tips and strategies about how you can seamlessly and profitably integrate preventive dentistry into your everyday workflow. Consider this just the beginning of your preventive dentistry toolkit. Do you want to go even deeper into implementation on how to really make the extra steps? Provide your team with structured training resources regularly, workshops, online courses, or coaching sessions. They are available everywhere and also here on our website. For sure, we will give you some teaching tips and tricks. Let's quickly recap today's episode. Prevention remains highly relevant even decades later due to its undeniable long-term benefits. Common arguments against prevention include economic concerns and patient interest or lack of interest. But with structured integration, clear patient communication, and dedicated team involvement, these can easily be addressed and overcome. My practical advice: introduce short, consistent, and structured prevention measures in your dental practice, leveraging your team's capabilities in communication and communicating financial benefits clearly. I invite you to reflect and consider, what is your current stance on prevention? And could you elevate your practice further by making it a stronger focus? Share your thoughts, experiences, and questions in the comments, or directly contact me or us. I would love to hear your perspective. Finally, don't forget to subscribe, follow our episodes, and share this with your colleagues. Let's build a community that actively engages with dental innovations, ensuring success together. Looking forward to see you again soon.